is safe and effective.
I do agree with that level of suspicion and that way of questioning it.
Keith Grant is the Senior System Director for Infection Prevention at Hartford Healthcare. He says vaccine development was historically fast, and it worked.
I've had more than one person say, look, we're in a big clinical trial. This thing still isn't scientifically proven. They don't know. We're still part of the big test.
Over 5 billion people have gotten the vaccine. The impact on the vaccine, if you look in Europe, they are now having soccer games. You know, a soccer game in Europe is 100,000 plus people.
Camille has a vaccine exemption from her hospital. They do test her regularly. She has 3 sons, all unvaccinated too. Her 16-year-old wants the shot, but she won't let him get it.
My 16-year-old has asked me several times, can I just get vaccinated?
And what'd you tell him?
I said no. Until you're 18, you can make your decision, but for now, I think by that time we'll have more evidence and more knowledge.
There are people who are going to hear that and gasp. What do you say to them?
What it comes down to is people being able to make the right decisions for their own family.
Is there a part of you that wants to protect your sons from that?
From COVID? Mm-hmm. Absolutely. Absolutely. But they're kids. I feel like they'd be able to bounce right back.
It's playing the odds. Yes, you're right. Most kids do very well with COVID-19, but you add vaccines to that and you add your masking and you add proper social distance, it puts you in a much better position. And this is not a position that is preventing anything but death. I mean, that's I think that's a big thing.
Where do you get your information about all this?
I'm getting a bachelor's program, so I know where to go for good. Media, obviously not.
Is politics part of where you're coming from with this?
For me, yeah, it's about freedom. I think the government should not be able to tell us what to put in our bodies.
Camille says while her fight over the COVID vaccine goes on, her number one concern has never changed.
And our number one concern is our patients. No matter what.
Tomorrow night, we will introduce you to a New Haven pastor at a predominantly black church. He says the black community does not want to be bullied into taking a vaccine, and he says you cannot trust the science. That's tomorrow night at 11.